People get overpayment notices from the Social Security Administration on a daily basis, particularly at this time during tax season. Worked too much last year. Somebody used your number, whatever the case may be. So, I'm going to talk about that today, overpayments and how to avoid them. And there was a new policy that just came out a couple of days ago from the Acting Commission of the Social Security Administration, changing the policy on overpayments. And unfortunately, it's going to hurt a lot of people. I talked about this a little bit in my live Q&A yesterday, but a lot of people had questions, so I want to answer some of those questions today. All right, if you're new to my channel, my name is Ed Weir. I ran the third business Social Security office in the country. Now my semi-retirement, and I help you all make sure you get everything you earn from Social Security, retirement, disability, survivor benefits, Medicare, Medicaid, all the rest of it. This is also a live Q&A. I already got tons of questions already, so I'll go through my agenda for today as quickly as possibly, answer some of your questions on that, and then I'll get into your specific questions on anything else related to Social Security. And remember, our sponsor is Chapter Medicare. This is also the Medicare season, so if you need help, definitely reach out to them. All right, so yeah, a lot of overpayments. Social Security does actually a fairly good job under, several reviews by several outside agencies for the last decade or so. It's probably about 1%, less than 1% of incorrect payments to people. So which is not too terribly bad considering they pay out close to $1.2 trillion last year. But sometimes those are strategic overpayments that people do, and we'll talk about that. I used to recommend these strategic overpayments, but probably not anymore considering the new policy here. Okay, so if you get an overpayment, it's basically for some reason Social Security paid you more money. And there are things called underpayments as well. Social Security didn't pay you enough money that you earned. And those where the 1%, it's incorrect payment. So the incorrect payment could be either an overpayment or an underpayment. But we're not going to talk about underpayments today. We'll talk about the overpayments where the Social Security Administration just paid you too much money for whatever the case may be. So it could be the Social Security mistake. If you are receiving benefits and you notified Social Security of work, particularly like disability benefits or something, or you filed for retirement benefits early and you notified Social Security that you're going to work or change work or make more money over the annual earnings limit or something, and Social Security doesn't input that correctly, or they do it late, or whatever the case may be, and this is going to get a lot worse going forward because they're laying off anywhere from 12 to 20% of the staff. So there's offices closing throughout the country, and even those offices that continue to be open don't have the staff, or the wrong staff. I've talked about this a few times. Social Security offices, there's basically three different types of employees. You got Title II, which handles retirement, survivor benefits, Social Security, disability, child benefits. And then you got SSI. Those are the people that handle the welfare-based program. And then you got the regular generalists that help you with kind of post-entitlement things. And some offices, even though they look open, they might be effectively closed for what you're looking for. So there's gonna be a lot more overpayments and underpayments going forward because they just don't have enough staff. And Social Security has already been at a 50-year low in terms of staffing. This has been a long time coming, but it's gotten 10 times worse in the last couple of weeks. So even if it's not your fault, it's like, hey, it wasn't my fault. It was Social Security's fault. Or if it was fraud, somebody used your Social Security number and did this, that, and the other, and then all of a sudden you got overpaid. Doesn't matter. You got overpaid. You need to address it. And how do you address it? I'll get into exactly how you address it here in a little bit. But there's a brand new Social Security policy that just went in, that it's not into effect yet, but it will come into effect March 27th. And so this just came out March 7th, and they are returning to an old system that's been around for a while. And it's going back to prior, the first Trump administration, the Obama administration, where if you have an overpayment, they can withhold 100% of your checks going forward. So if they send you a letter or something like that and you don't respond immediately, and that's the issue right there. But if you get an overpayment, they'll withhold 100% of your check. And so I did a video yesterday that says this is going to be really tough for poor people because, people that are just living, the millions of people just living on Social Security, if they miss a check for a month or 2 months or 3 months, then, they're in dire straits. If you've got some money in the bank so you can, hold out for those 2 or 3 or 4 months until your check starts again, then you're okay. But a lot of people, unfortunately, millions of people are just depending on Social Security, or that's their major source of income. But this new policy is not going to start until March 27th. Okay. So if you currently have an overpayment and you negotiated the overpayment, or you've got a payment plan all set up and everything, you're good. For now, we'll see what the new policy is. They right now it's you get an overpayment, you negotiate to pay it back in 12 months or 50, 60 months or whatever the case may be, and there's no interest. So we'll see if that changes here. That could be a lot of places where the Social Security Administration could make some money by charging you for an interest rate, but as of right now, they're not. But okay, so it's returning to an old policy that they'll automatically withhold 100% of your check until you get everything fixed, and that's the issue right there. Is starting March 27th, if you get overpaid, even if it's not your fault, somebody stole your stuff, you called Social Security, notified them, whatever the case may be, but something happens and you get overpaid, starting March 27th, they're going to stop your check completely. And it was tough. That's the way it was, under the Obama administration, under the first Trump administration, under, many years ago before, in the Clinton administration, the Bush administration. It's been like that for a long time. But the difference is now is at those times, offices had staff. I mean, it was still at a 50-year low, but they had some semblance of staff that could help you out. But now with the offices closing and you can't get an appointment for a month or 2 months. So that is something that the realities have completely changed. So if something happens, you're supposed to contact Social Security, and anybody that's tried to contact Social Security within the last week or so knows that it's 10 times worse than it was a month ago, and it's going to get even worse going forward, because they said they're going to summarily discharge, early retirement, push out, voluntold, whatever the case may be, 7,000 Social Security employees, and there's 57,000, which is a 50-year low. But I've been hearing from the grapevine that it's going to be more than 7,000. So, and again, there's no rhyme or reason. So entire offices, some offices have already closed. Other offices are effectively closed because all they have is, people that do the welfare, and then you call them up wanting retirement or survivor benefits, and they say, sorry, we don't have anybody there that can do that. We just do SSI. So same thing with overpayments. If you get an overpayment and you call and say, hey, it wasn't my fault, I want to go ahead and negotiate, I want to do this, that, and the other, they're going to say, well, we can schedule you an appointment for sometime in a couple of months. Well, what do I do for my check? Well, sorry, we'll talk to you in a couple of months. So this is going to be a very, very difficult thing for a lot of people out there. And a lot of people receive overpayments, and they do so voluntarily. They want the overpayments. It's a strategic overpayment. If you've been watching my videos for any length of time, I also kind of recommend strategic overpayments. And what it is, if you're under your full retirement age and you want to start your Social Security benefits, retirement benefits, spouse benefits, survivor benefits, whatever the case may be, and you're continuing to work, like this year, the work limit is $23,400. And you're like, am I going to keep under 23,400? I'm not sure. I might get close to that in, November, December. And so I might be like 1,000 over. So if you're 1,000 over, Social Security holds back $1 for every $2 you go over. So, they'll hold back, one check, possibly, depends on how much you make. So they'll withhold X amount of checks. And some people say, well, rather than calling Social Security up, which they don't pick up the phone now anyway, and telling Social Security beforehand that I'm going to make $1,000, $2,000, $5,000 over, I'll just go ahead and let it ride because I'm not 100% sure whether, I am going to go over that. I won't know until November, December. So it's kind of a strategic overpayment. And then when you receive your nasty gram in, the following year, January, February, March, where it says, hey, we were just notified by the IRS or your employer that you did make over this amount of money, so you owe us X amount of money. So we're going to stop your payments until you get it figured out. And in the old days, that is AKA 2 weeks ago, you just negotiate and call them up and say, okay, you're holding 10% of my check. Okay, no problem. But let's go ahead and negotiate and you're good. But now they're withholding 100% of your check. And if you can get in there immediately and get it addressed, then you should be okay. But it's to get in there and get it addressed is going to be very, very difficult. And you just might miss a month or 2 months. And then if you miss a month or 2 months, and if you're on Medicare, that means you're not going to pay your Medicare possibly. So you might lose your Medicare. If you're on Medicaid from the state, you might lose that because you're it's a trickle down effect. Unfortunately, the powers that be that are making these decisions don't know how all of these systems integrate with each other. They're just, hey, here's a bunch of money here, so let's go ahead and just cancel this or do that, and let the chips fall where they may. And unfortunately, the chips are falling to a lot of people out there that just can't afford it. So again, if you have a current debt with the Social Security Administration, you currently have an overpayment, you should be good. You're, as of right now, let's say it this way. As of right now, you are good. You don't have to do anything. You don't have to renegotiate if you don't want to. You might want to stick around. I'll tell you how to renegotiate here. But this doesn't affect you. This is only for brand new overpayments as of starting March 27th. So if anybody gets overpaid starting March 27th, whether it's for last year or 2 years ago, whatever the case may be, then they're going to put you on 100% withholding. Okay, what do you do if you get that letter? Do as you normally do. You have to fill out a couple of forms, or maybe one or two. Depends on your particular situation. The request for a waiver or the request for a kind of a negotiation, you can actually there was a change last year where you could actually call up and say, okay, I worked too much. This happened. It was my fault. So I want to go ahead and set up a payment plan. I owe $10,000. So what you can do is you can set up a payment plan up to 60 months. It's very easy now. Anderson Cooper did a story on 60 Minutes many months ago, and that changed. Social Security changed the policy where you can negotiate. It's easier to negotiate a repayment plan once you're able to contact Social Security, and you can do it up to 60 months. Before, it was 12 months, 24 months. After that, it was very difficult. So they changed that. And part of that Anderson Cooper story, they changed that part that you could renegotiate it for a longer period of time and easier. They also changed it where instead of withholding your whole check immediately like that, they would only withhold 10%. But now it's gone back to the 100%. So if you get an overpayment, contact Social Security immediately. And if you agree with the overpayment and you're willing to do a repayment plan, and remember, Social Security, as of right now, they don't charge you an interest. So it's interest-free loan, I guess. You can call and negotiate it up to 60 months. Okay. All right. If you disagree with the overpayment, then you got to start doing with the bureaucratic forms. One of them is the SSA 632 request for waiver. And you request the waiver and you say two things have to be met for the overpayment to be waived. So if you have a $10,000 debt and you say it's not my fault, two things have to be met. Number one, it's not your fault. And number two, you don't have the ability to repay. So if Social Security makes a mistake, for instance, and but you make $1 million a month, they're going to want their $10,000 back, even if it wasn't your fault. But if Social Security makes a $10,000 mistake and it wasn't your fault, and you're barely scraping by, you've got, after the end of the month, you've only got like $10 left, then Social Security usually waives those, or depends who you talk to, might request the $10 a month. But anyway, so those are the two hurdles you have to jump over. It's not your fault and you don't have the ability to repay. And how do you go through that? You do the SSA 632, a request for waiver. You provide your documentation, says, hey, I don't have the ability to repay. Here's how much I make every month, and here's how much I spend every month for expenses and mortgage and rent and food and all that stuff. And then they will make a decision whether they're able to waive your overpayment. And then there's the SSA fixed 561, where you can request a reconsideration of that overpayment. A lot of Social Security employees kind of mess these two forms up. They don't understand the difference of them. But it's basically if it says you have a $60,000 overpayment and you say, no, I have an overpayment, it's about $30,000, not $60,000. Your calculations are wrong. So you can request a reconsideration of the overpayment amount through an SSA 561. And with anything Social Security, you always have appeal rights. So if you get an overpayment and you dispute it, appeal it, and with a 632 or a 561, and they deny it, then you go on to the next stage where you requested another appeal, and then eventually you go see an administrative law judge, which has a little bit more latitude than regular Social Security employees, and they can possibly negate your overpayment. And the great thing about that is if and it takes about a year or two to see an administrative law judge. Well, it did up until 2 weeks ago, but it's going to get worse now. But if you have an overpayment and you say, okay, I want to speak to administrative law judge. Okay, 2 years from now, you'll go ahead and talk to them. But right now we have to set up a payment plan of $100 a month. So if you pay $100 a month for 2 years, and then the administrative law judge says, okay, you should have never had to pay that, they will pay you all that money back. Social Security will pay you all that money back if it's so ordered by the administrative law judge. All right, so there's a lot of different variables. Strategic overpayments, if you watch my videos before, again, it might not be advisable right now. So considering the new reality, again, if you can go for a month or 2 months or 3 months without a check, then the strategic overpayment might be an option for you. Okay, let's go ahead and I tried to get through that as simply as, well, I don't know about simple, but nothing with the government is simple, but quickly as possible so I can get to as many of your questions. Let's start off with Linda. What about if you apply on your 62nd birthday? I only have a pension that I stretch already. I retired early, medical issues. Okay, so all kinds of stuff in there to unpack. Number one is you can apply on your birthday, 62nd birthday. Your benefits won't start until you're 62 the entire month. So if you were, born on the 1st, then you can start the month you turn 62, but you have to be 62 the entire month. So if you were born on the 2nd or something, then yeah. Anyway, so that's number one. And remember, the checks always come a month late, in arrears. So if you start your benefits in February, your February check comes in March. If you start in March, your March check comes in April. All right. So a pension that doesn't affect your Social Security benefits. It doesn't. That isn't included in the annual earnings limit, the $23,400. The annual earnings limit is only earned income or net income from business. And Linda, one last thing: you retired early for medical issues. Do your medical issues prevent you from working? If so, you might want to think about filing for Social Security disability benefits. Because you can file for both retirement benefits and disability benefits once you hit 62 there. And why would you do both? Well, if you're approved for disability benefits, number one, you get a higher benefit amount most of the time. Number two, your Medicare starts early. For you have to wait for Medicare to start at 65. If they approve you for disability, your Medicare starts at 64, a year early. So, and why people do both is because it takes forever. When I was taking disability claims, when I took the 100,000 disability claims I took when I was an actual claim specialist, me and everybody else at the agency at the time were said, hey, you'll have your answer back about your disability in 3 to 6 months. Recently, they've been saying 6 to 9 months because of the low staffing. Now it's anybody's guess how long it's going to take. So people just can't wait for that long to get their disability check started. They need income while they're waiting. So that's why people go ahead and file for retirement benefits early while they're waiting for their disability. And it depends when they determine your disability onset date, when they determine you're unable to work. It might reduce your disability a little bit because you were you were already taking retirement benefits. But yeah, if you want to do that, just call up Social Security, and when you're about to file, and say, hey, I want to file for retirement, and also disability too. Let's try disability again. If Social Security defines disability as inability to work, and that disability has to last 12 months or longer. Let's see. I guess Annie is answering somebody else's questions. Rami Black consider herself lucky to have a waiver. I've been appealing my $45,000 overpayment for years. I'm 44, disabled, and on SSDI my entire adult life. Yeah, something like that is usually based on work, trial work period, SSDI, that you worked a little bit, maybe worked over. I'm just kind of guesstimating that's 90%, 95% of the time people get overpaid when they're on SSDI. But yeah, it sounds like you're in waiting for the administrative law judge to talk to you and see your case. So I would like to know, if I retire at 64, how much am I allowed to make besides what I get from Social Security? At 64, you're limited this year in 2025 to $23,400. Anything over that, they hold back $1 for every $2 you go over. Alan, income inequality is why Social Security Trust Fund is being depleted so quickly. That is a fact. Yes, in the 1980s, they saw the baby boomers and all that, so they took all those into calculations, but they didn't realize that regular working people's wages would be flat for decades. But the money that used to go into Social Security, that used to be subject to the FICA tax, is now going to the really wealthy, and they don't pay FICA tax on anything over $176,100. So if we remove the FICA cap, then there will be no cuts in the next few years. But unfortunately, I don't see that on the block here. But we can always hope. There are a couple of senators, Bernie Sanders, Larson, that introduced those as bills, but support them. Yeah, if you believe, everybody should pay the same amount of FICA tax as we do, then it might be a good idea to support them. Planned on retiring early at 66 in February 26. Earnings limit, how much can I earn from that? And can I earn 9K bonus? Okay, so sounds like you're still under your full retirement age. I don't think possibly your full retirement age year is 2027, possibly. But anyway, let's say you're under your full retirement age. You're not at that year. Then it doesn't matter. You can switch to what's called the monthly earnings limit. A lot of people miss this. So please share and like and subscribe and stuff so more people get this information, because a lot of people are, leaving money on the table that they shouldn't. So if you're 62, 63, 64, 65, under your full retirement age, this year you're limited $23,400. If you make over that, they hold back $1 for every $2 you go over. Okay. Let's say Mylin here. Let's make it easy. She's going to start her benefits in July. Social Security doesn't care what she makes from January to June. So you can make $1 billion from January to June, but Social Security will ask you, okay, we're going to start your benefits in July. Starting July, are you going to earn under $1,950? And if you say, yep, I'll stay under $1,950 starting July, and then every month for the rest of the year. And they said, okay, perfect. We can start in July. The $1 billion you made before that, we don't care. We just care about when you start your benefits. And then next year you have to stay under the annual earnings limit. You can't use the monthly two times. You can only do it the first year. So that is the difference. There's a lot of people who say, well, I already made, over 23,400, so I can't start my benefits this year. I really like to, and I need the money and stuff, but I guess I have to wait till next year. So many people out there that are just sitting around losing money. It's I just received a retro payment. How many months since 1/1 does this include? Yeah. So if you are talking about the Social Security Fairness Act that the Congress and the President signed, starts, it'll tell you on the letter. So you get back pay all the way back to January of 2024. I call it the Social Security Fairness Act, and because it is unfair to the other 97%, but anyway, there it is. Can we review the Social Security accounting anywhere, income and expenditures for benefits and administration by year quarter? Yeah, absolutely. Easy. Social Security trustees report. Yep, it's all completely there. Tells you exactly how much is in the trust fund, how much interest was earned on the trust fund, how much came in from taxes on Social Security. All the rest of it is in there. Yep. People may often make remarks about Social Security without reading the actual material, and they just see stuff on the internet myths. This is how efficient the employer's services. Okay, let's see here. Okay, SSI website, Social Security. SSI is a welfare-based program, but you mean SSA. Social Security website says, I'm waiting on a hearing. It's been 8 months. I'm 48, single mom who can't walk, triplet kids, 12 years old, deceased father. Wow. So waited on a hearing. So you're not waiting on a disabled widow's benefits. I wonder, yeah, that's strange. So there might be, it's a issue with the father wasn't the natural father, or the adopted father, or the stepfather was providing house support. I can't understand why you would be waiting a hearing on that. If it's a disability type thing, I can understand. But if the children have a deceased father, the children are entitled to survivor benefits on the father's record. Maybe you are waiting for disability benefits on your own record, but in the meantime, I just want to make sure, are the children receiving benefits on the father's record? If the father paid into Social Security, was entitled to Social Security, insured into Social Security, then the children, at the very least, should be receiving benefits on the deceased father's record. Perhaps you are just waiting for your own disability claim to be approved. They were denied. Bernadette, hey, Bernadette, if Social Security is privatized, it will then disappear. They have been trying to get rid of Social Security for decades. This is the different approach. They will not stop until they demolish Social Security. Yeah, that's unfortunately kind of one of the strategies, is to, just because they tried it under the Bush administration to try to just kind of, wipe it out, or give it over to Wall Street. And, we slapped them on the hand really bad, really hard for that one. And so they came up with another plan, a long-term strategy to destroy people's confidence in Social Security. And they've been doing a phenomenal job on that. All these crazy, supposedly the zombie apocalypse that are collecting Social Security checks, which has been, disproven, but they keep repeating it, trying to destroy our confidence in Social Security. And now they're trying this other strategy where the strategy is to make customer service so terrible that, people will just get completely frustrated and just give up. And they've been working on that for decades. And that's why Social Security is at a 50-year low. And it's not just one political party. It's both political parties. One political party was, consciously doing that. The other one says, we're going to save it, but they were incompetent in not doing it. So, yeah. So, let's see here. I will call your chapter about Medicare, but today I ask, if I add more to Medicare, like D, G, et cetera, could I change it later on, or is it permanent? D, the prescription drug plan, those are only good for 1 year. So your Part D prescription drug plan is only good for 1 year. So if you don't do anything when the regular annual enrollment period starts in October 15th to December 7th, if you don't do anything, then it just automatically kind of renews. Medicare Advantage, same type of thing. If you're on a Medicare Advantage, those are only good for 1 year as well. But if you don't do anything during the open enrollment, and this is also the open enrollment period, January, February, March. So if you have a Medicare Advantage plan and you don't like it, or you forgot to check it recently, and you want to see if there's any changes or anything else extra you can get out there, you can reach out to my partners at Chapter, and they can go through your plan 100% free. But in terms of a Medicare G, so you're talking about a Medicare Supplement Plan G, those you can change 365 days of the year. You don't have to wait for open enrollment period or annual enrollment period or any of that stuff. You can change that anytime you want. However, depending on your state, you might have to go through health underwriting. So if you have a Medicare supplement, which are the ones I always recommend, if you can afford them, if they're right for you, get those if you can. A Medicare supplement plan G or N. But if you have one and it's getting kind of expensive, an F or a G or an N, it's starting to get expensive. You want to see if you can get a cheaper one. Again, you can reach out to Chapter or whoever signed you up for those and say, "Hey, is there anyone any cheaper out there?" And they'll say, "Well, in your particular state, I'll have to ask you about 30 questions about your health. And if if you're all good there, then sure, might be able to save you some money, 10, 20, 30, 40, $50 a month with a cheaper plan. And you can do that 365 days of the year. Your Part D, you pretty much can't change until the annual enrollment period in October, unless you move or something like that. Ed, you're a real American hero for bringing the bell and speaking the truth. Thank you. I appreciate it. All right, thank you. I was the one they took money back, and I had the New Mexico appeal because the back pay was under for a year. Okay, perfect. Yeah, just with everything, with Social Security. With Social Security, if you disagree with the decision, appeal it. If you have a Medicare Advantage plan and they deny your prior authorization, the doctor says, "Hey, we need to do X, Y, and Z," and the insurance company says, "No, we don't want to pay for that." Appeal it. Always appeal everything. So. And on the Medicare Advantage side, it's the statistics have proven that if you appeal whatever denial they give you, there's a very, very good chance you'll win. So always appeal it. Yes, the goal is cruelty and greed. Have you seen the House bill and how many hundreds of millions of dollars they take away from programs that help people stay alive? Yeah, and they're looking for every dime they can to give, these tax cuts that predominantly they give a few pennies to the rest of us. But yeah, let's see. Yeah, it's unfortunate. The SSI payments needs to be removed from Social Security. It is not what Social Security is intended to. Retirement for seniors. SSI wasn't started until 1974, passed into law in 1972. Yeah, Michael Moore. Yep, you're correct. SSI, the welfare-based program, they were kind of a hodgepodge of programs, welfare-based programs throughout the country. Different states were doing different things, and then under the Nixon administration, they federalized it and gave it to Social Security. And so but if it doesn't come out of the Social Security, the money doesn't come out of the Social Security Trust Fund. So that's not an issue. The SSI, supplemental security income, comes out of just regular taxes. So if then give it back to the states, but there's people still need that help. They only get $967 from SSI. That's the max you can get from SSI. So again, give it to another agency. Since Social Security doesn't have the staff to do it anymore, give it to another agency. But I would argue it still needs to get done. And it never hurts Social Security because it's never part of it's not taken out of the Social Security Trust Fund. So it doesn't deplete the trust fund. Dr. Ed turned 62 in February 2025. I applied online for my Social Security benefits. Salinas, California rep is working on it. Will I be able to get the first check in April? A couple of weeks ago, I would say, you should be good. You should be good. It just, whether you get it in April, it depends. Salinas, they have a teleservice center. So if you applied online, it might not go to the actual Salinas office, which I would recommend once in your life, go to Salinas and go to the John Steinbeck Museum in Salinas, got a Monterey and all that stuff, right? Grapes of Wrath and all that. But Salinas has a teleservice center, and they have a center there that usually does the online type stuff. So it's not like a regular district office. So hopefully, yes. But regardless of the fact, if it takes them a month or 5 months or 6 months or whatever the case may be to do it, they will pay you back. If you turn 62 and you were 62 the entire month of February, then your first check will come in March. But probably you're entitled to your first check in March, and your March check will come in April. So hopefully that happens. And if it doesn't, if it takes longer, then they will just pay you the 2 months or 3 months back. Or let's see here. If you expect a certain amount and your bank statement says otherwise, common sense should kick in. Never take anything extra from the government. Yeah, but a lot of people, don't check their bank on us. The old days, we used to balance your checkbook and stuff. Anyway, I always balance my checkbook. Yeah, I'm completely lying there. But anyway, but yeah, there are, people get COLA increases and they think it's a COLA increase, but it wasn't a COLA increase. It was something else. And then people, when they work, and that year that they work is one of their high 35 years of earnings, and so their benefit increases, so they think that's the reason, but maybe it's not. So yeah, it's sometimes difficult. You're supposed to receive a letter from Social Security that says, hey, we just increased your benefit amount because of X, Y, and Z. And if you disagree with that, then you say, hey, wait a second, what's going on here? So when does Social Security start allowing people to game their biggest check, claim theirs an X? I am for survivor benefits, but divorce spouse benefits should collect theirs, not a bigger check for an X. Okay, all right. So a couple of things there. So if you're collecting benefits on your own record and you're entitled to spouse benefits or divorce spouse benefits, you have to you have to have started your benefits on your own record, and then you can collect spouse and divorce spouse benefits. For survivor benefits, that's different. So you can collect survivor benefits, divorce spouse benefits, whatever, surviving spouse benefits, as long as you're married to the person for 10 years or longer. And don't touch yours, and you let yours continually increase, and it'll continue to increase until the month you turn 70 years old. So yeah, that's been around for a long, long time. A lot of people take advantage of that, and makes their life so much easier. Let's see. I'd sold about $1,600 of personal electronics on eBay in order to buy some furniture that I needed in August of last year for the first time. Is this considered SGA by SSA? What do I do? No, something like that, just kind of a side type thing. Unless you have a business selling on eBay and that's your business, you have a company, it's net income from business and all that kind of stuff. But if you're just selling personal type stuff or having a yard sale or something, it's not considered really earned income. You're just kind of liquidating your assets. But if you turn liquidation of your assets into a business, because you got tons of assets and you buy and sell it, then it turns into a business, and then it becomes the net income from business. And then if that is substantial gainful activity, then that triggers the whole trial work period and all the rest of it. Make sure you watch my videos I do on, working on Social Security disability. Anna, husband passed 12/24. Is it true I, age 78 and drawing owned since 62, can draw his benefit? He started SSDI since 55 at 100% and is retroactive for 6 months from his death. Yeah. Yes. So I would definitely reach out to Social Security and see if there are higher benefits on his record. And you'll receive 100% because you're past your full retirement age. And yes, ask for the 6 months of retroactive. Well, you can't go back until the month he passed, so you can't get the full 6 months because it's only March. But you can go back to December and get that benefit. So yes, and you can't do that online. You have to actually call and schedule an appointment. So yes, make sure you do that as soon as possible because it's going to take a while to get everything started. And in terms of documentation, it sounds like you were married to him, so you don't need the death certificate. That's automatic. If the person, passed away in the United States, that's all automatic. May need the marriage certificate, but don't wait. People often say, well, I'll call up Social Security once I get the marriage certificate and the divorce decree and the death certificate or the medical records or something. No. Never, never, never wait. Call Social Security immediately, and that protects you for that particular month so you don't lose that month. And then if you think you need X, Y, or Z, then start getting it. And then if you don't get whatever documents you think you need by the appointment, don't cancel the appointment because you don't have your documents. No, never do that. Just take the appointment because the person might say, well, no, you don't even need that. So you don't want to lose benefits. You want to make sure you get everything as soon as possible. Since Social Security does not answer the phone and the office not staffed, how can one negotiate an overpayment? Exactly. That's the cruel part of this whole new policy. Again, it was the 100% withholding was in place for, decades, and okay, but that's when you could actually get a hold of Social Security and renegotiate. But now, yeah, that's the backdoor way to hurt the people that can't, that have a hard time, living on a day-to-day basis. So it's kind of like the old, I'm using this line quite often recently, that the old Eagles Hotel California. You can check out anytime you like, but you can never leave. You can do this anytime you want, but you can't get a hold of us. So, or them. Ed, can you file for SSDI while receiving workers' comp? Yes. Or does one program offset the other? Yes. You can file for Social Security disability insurance if you're not working. Your workers' comp is not considered working. But workers' comp, yes, it will offset what you're receiving from Social Security disability insurance. That's one of the only things that does. Public disability benefits, workers' comp type stuff, not private disability, long-term disability from a company or some private insurance, but workers' comp type stuff. The reason is Congress said, if you're receiving Social Security disability insurance, you shouldn't make more receiving, Social Security disability and state federal government workers' comp. So if you were making an average like $3,000 when you were actually working, and then you become disabled, and with your disability and your workers' comp, you're making $5,000 a month more than what you're working. Then Congress said, yeah, that's not right. That's why one offsets the other. So. Many of us worked many years and paid taxes for many years to build America. We earned our Social Security. Exactly. And the tragedy is you also paid into Social Security for customer service, for help when you needed help. So you didn't have to go to, YouTube and listen to me, blabber on for an hour every day. You paid for Social Security to be there to help you to take your claim and get your right check at the right time and give you the right information. But unfortunately, Congress has decided for decades that no, not so much. We'll just keep cutting Social Security back until y'all hate it. And once you hate it enough, then we can do whatever we want with it because y'all hate it. And so if we say we're going to give it to this guy or that guy, then y'all won't say anything because you hate it anyway. And so we have succeeded. Starting Medicare at 62 would at least sync it up with people who start Social Security early at 62. Cheers, Michael from Albuquerque. Yes, I agree. If I was dictator for a day, that's one of the things I would do is rather than being 65, if you file for early retirement at 62, or if you're filing for survivor benefits at 60, I would argue your Medicare should start at the same time rather than have to wait till 65. But regular viewers to my channel know if I was dictator for a day, the first thing I would do is cure for male pattern baldness. Hey, I do have my priorities. Sorry, everybody. So they intentionally overpay you, and then they wait 5 years to mess up your life, and then they garnish your wages, or they take it out of the disability, make it difficult for you to. Yeah, they don't intentionally do it. Yeah, no, nobody intentionally. Yeah, that is the number one job of Social Security employees. I can tell you because is to make their own life easier. When you're hired from Social Security and you're going into the training, which it takes, 3 months of everyday training, they tell you it's easier to do it the first time because if you have to fix it, it takes you 10 times longer. So make your own life easier by doing it right the first time. Because if you mess up and do the overpayment, you got to do the recalculations and you got to do this and you got to do A101 and 632 and 561. And it's a nightmare to fix anything. So it's always do it right the first time. But unfortunately, with the workloads and everything, and and there are some employees that are not great. But that's the unfortunate part. Now, the senior employees, the people that are really the experts, are being pushed out of the agency, and the writing is on the wall. They've received a letter and says, hey, you can leave now, or you can, throw the dice, and we might eliminate your job later. And here's a little carrot of, a few $1,000s. So the senior people are leaving. They just say, I'm close to retirement. I'll just go ahead and bail. And the people that are really good, they're really good and they can get a job at another place making more money. So they're jumping ship. So what's going to be left is the newer people that can't get a job pretty much anywhere else. And so it's going to get worse and worse and worse and worse. And by design, that's exactly, yeah, that's exactly how they've planned it. And if you disagree, you can read the playbook in my YouTube description. It's by the Cato Institute. They wrote it in the 1980s, and this is the playbook, and it's working perfectly for them. I'm a 100% disabled veteran. I should be fine. Yeah, well, I just did a video on that about 3 or 4 days ago because they're cutting back on the Veterans Administration, medical, and everything like that. So it's important, and particularly now, March 31st is the deadline. There's 2 deadlines for veterans out there, so please reach out to your veterans. Because the Veterans Administration, Department of Veteran Affairs they're losing maybe 80,000 people or so, and so the healthcare from maybe your local clinic is not going to be the way it was before. So an option is to get your Medicare, but a lot of vets, not TRICARE people. TRICARE, those are the people that actually retired, like me. I'm not eligible for TRICARE because I didn't retire from Social Security. I only put, I didn't retire from the Marine Corps. I only put in 8 years, so I'm only eligible. I'm not eligible, but for VA medical, it's income resource limited. But people that just use VA medical, they refused Part B, because you have to pay $185 for Part B. And they said, I don't want to pay $185 because I get most of my health from the VA and I'm happy with it and it's close by and it's convenient, yada, yada, yada. Well, that looks to be changing. And I recommend at least looking back and saying, okay, well, maybe I should go ahead and, dole out the $185. But I got a couple of tricks here for you. You can number one, you have until March 31st to do that. We're now in the Medicare general enrollment period. So if you call up, it's March right now. If you call up Social Security and get your Part B started, it'll start April 1st. And then you can get a Medicare Advantage plan. I always recommend Medicare supplements, but if you have VA, then probably I wouldn't recommend paying an extra premium for a Medicare supplement. A Medicare Advantage plan, they have 0 premiums. Check out one of those, and they have ones that are called Medicare Advantage Part B Give Back, where if there's one available in your particular area, it'll pay for part of your Part B premium. So you're like, I don't want the Medicare Part B because I can't afford the $185. Get a Medicare Advantage 0 premium plan, and they might pay for $50, $100, $150, $185. There might be one available in your area. So at least check it out. And you have until March 31st to check it out. So you can reach out to Chapter and they can look in your particular area and see if there's one available. Unfortunately, they're not open today on Sunday, but give them a call tomorrow and they can help you out. So any veterans out there, you have 2 deadlines. Again, your Medicare, the Medicare general enrollment period, sign up for Part B, have to do it by March 31st. If you already have a Medicare Advantage plan and you don't have one of those Part B give backs, or you got it and now you might need more health care, you might have more issues and you haven't checked your Medicare Advantage plan in a while, then it's a good idea to review it. And again, my partners or Chapter will help you review it. No cost to you at all. Okay, let's see here. I try not to get too much into partisan type of politics. I'm in my Social Security account right now, and when I click on deductions, there's a bullet item that says part of your payment may be withheld for payment of your appointed representative. Yeah, so if, that could be a few things. So did you apply for disability benefits and you hired a lawyer? So if so, then if you're approved for disability, then they'll get 25% up to $9,200. I think they just changed it to that amount. Or if you have a representative payee and someone that's taking care of your benefits, they can charge for that assistance. So, but it says it may be withheld. So that might just be, yeah, it just might be just a, a legal type thing. I have watched a lot of experts on Social Security, and Dr. Ed is by far the best and has a lot of more detail than other channels. Thank you. I appreciate it. Yeah, a lot of them out there just kind of read the news and, never worked at the agency. And unfortunately, I watch them all too, those other social media websites and channels. And then when they say something incorrect, I have to come in here and says, okay, I saw this myth going out there, and they're partially right, but there's exceptions or they're completely wrong. So yeah, maybe they do all this in your state, but they are so rude in New Mexico. They don't do any of this, that what you're saying, unless you even have an attorney, and still wait many, many years for the at least. Sounds like an attorney type, sounds like a disability type thing. Yeah. Let's see. The sad thing is, instead of fixing this, people have gone in there and done. I don't know what to the computer system that is going to create mass chaos and pain. Yeah, that's the previous commissioner of Social Security. He says, he's been doing a lot of interviews the last few days, and he's talking about the computer system, which Social Security has been begging Congress, please, we need to fix the computer system. It's based on 1970s technology. We've been keeping it together with string and bubble gum for decades. Please, we need to update it. And Congress said, no, 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 we're not going to do it, because they don't want it fixed. They want it to break so they can pick up the pieces. So Social Security has been begging for that forever. And, but now, it's getting worse. It's always been bad. I'm surprised it doesn't go down more often than it has. But now the people that are in charge of using bubblegum and string to keep it together, they are being summarily pushed out of the agency. And it's going to be, hopefully nothing happens, but I think, we should, always prepare. I was only on SSDI for 3 months, and I got a letter saying they overpaid me $17,000. Yeah. So it sounds like they approved you for SSDI, and then based on something, they reviewed your case, or you worked during that time. And that's usually how it happens. I don't know about your particular case, but usually, people file for disability, and then, they have to go back to work, and they go back to work, and they say, well, I'm waiting on my disability. Then your disability is approved. But then they say, wait a second, you've been working the entire time. So, why did I get a big Social Security extra payment? Is this the Biden payback plan? Not sure about that. How do I know it's correct? SSA extra payment. I know the IRS had some stimulus checks that people didn't get a few years ago during the whole COVID thing. And I know the IRS was going through those and paying those out, about 1,700 or so. But in terms of Social Security, what usually happens is, if you worked last year and you paid more into Social Security, and therefore your benefit goes up, or whatever the case may be, when they push the button, when whoever in the country, works on your record, and they say, okay, this person deserved more money, and they push the button, and you've got direct deposit, that happens like the next day. But as soon as they push the button, two things happen. The money goes out, and then the letter goes out, snail mail. So if you just got money in your bank, a few days ago, and you're like, that's going on, you'll probably get a letter very soon. And also go into your Social Security portal, and it might be in there as well. But if you just can't figure it out, you didn't work or anything like that, then definitely reach out to Social Security and say, hey, what's going on? Hold that money in case they want it back. Although I had not paid into a pension for those years, were deducted as years of non-payment to FICA. Can you explain what's going on so I know the right questions to ask tomorrow? Okay, not sure. So you had a pension, sounds like you had a non-covered pension. You worked for some city, state, local government agency that did not pay into Social Security. So they paid into the Medicare part of Social Security, of the Medicare part of FICA, but you paid into the Medicare part of FICA, but you did not pay into the Social Security part of FICA. So that's probably it. Unless net income from, a business, and you just didn't pay your taxes. So I am still working, and I'm 71, born in 1954. When I stop working, how long will it take to get the correct Social Security amount? Semper Fi, hoorah. So hopefully you're already receiving Social Security benefits, because remember, your benefits stop increasing the month you turn 70 years old. So hopefully you're already getting the benefit amount. But yeah, so if you're still working, and last year was one of your high 35 years of earnings, it's all automatic. Once Social Security gets all that information from your employer or the IRS, the Social Security computer system, if it's still up and running, will automatically calculate it. They'll look at your record, and they'll look at your high 35 years, and they'll say, hey, is this new year one of the high ones? And if it's one of the high ones, they'll kick out the low one, stick in the new one, recalculate. Sometimes people get that extra bump in March or April. Sometimes it takes until October. But if it takes until October, and you get an extra $10 a month because of work last year, they'll give you $10 a month more going forward, and they'll give you 10 months going all the way back. So you'll get a check for, $90, all the way back to January. So you won't lose anything, even if it took, everybody a time to get it done. Dr. Ed, will the checks be retrograde and the money replaced when they continue again? Yeah, with anything on Social Security, yeah. If you're entitled for, this particular month, and it takes Social Security a month or 2 months or 5 months or something to do it, yeah, as long as you're protected, it's called protective filing. As long as you're protected for that particular month, then they will pay you back however long it takes. But the problem is, again, that's putting, the millions of people that depend on Social Security alone, they're like, wow, that's great. Awesome that I will eventually get paid. And I'm sure that will work with my landlord, you know, but I will eventually get paid. Can you write a check on that one? Like the old days, when you used to write a check and you'd forget to sign it, and because you didn't have money to float it in the bank account. So am I the only one that did that as a anyway, they scared me when they took out my check and said I was overpaid. Yeah. And in the old days, you would just go in there and, negotiate, and they'd restart it in relatively short order. But now all bets are off, unfortunately. Social Security is too inept to know when it overpaid anybody. If they are at the ignorant, there is no reason to believe amount and payment demand letter. Yeah, I mean, consider less than 1% are incorrect payments. And most of those are, people that do voluntary, they do strategic overpayments. Because if you actually look at the numbers, people work too much during their annual, when they're filing for early retirement, and, they work an extra $1,000. And so they get paid on purpose. There's a lot of those. But another thing, and, I always try to stay optimistic. Elon Musk, if you want to help Social Security, one of the biggest things is you can help people on disability keep out of trouble, keep out of giving overpayments, because the whole system for, helping people go back to work if you're on disability, the trial work period and the extended period of eligibility and the trial work period trigger month and the SGA and all that kind of stuff, it's very, very complicated. So if Elon Musk and his Doge kids want to set up a system to help people, and that would help a lot of people and prevent a lot of overpayment. So, always Social Security is always looking. Social Security has been asking about that for decades, but Congress says nope. The rich need power, tax cuts, right? I applied for SSI for 65 and Medicaid to pay Part B. Good. I was approved for SSI, but my first payment in June for May. Do not know how long it takes for Medicaid to pay Plan B, and I do need other insurance. Yes, that's called a welfare accretion, and yeah, that's another place that Social Security has been requesting help. Is the Medicare, because you've got three different entities. You've got Social Security Administration, you've got your Medicaid office, and you've got Medicare. And the three computer systems are trying to talk to each other. What happened is Jose is receives SSI, the welfare-based benefit. So because he's receiving SSI, he's categorically eligible for Medicaid from the state. So he can go down there and they give him Medicaid. And if he gets the higher levels of Medicaid, then it's called the Medicare Savings Program kicks in, and they pay for his Part B premium, the $185. But three different computer systems talking to each other, and unfortunately, it takes a little bit of time. So you just have to keep up on it and call them and say, "Hey, can you pay? Can you pay? Can you pay?" And in terms of Social Security, they can't really do anything until Medicaid pays for that $185. But if Medicaid said they would pay in February, then they will pay in February. It might take a month or 2 months, but if they said they're going to do it, it 99.9% of the times, if you get a letter that says they're going to go ahead and do it, it just takes a while to figure it out. And if you had already paid $185 out of your check during that month or 2 months while you're waiting, then you will have an underpayment on your record. And then Social Security will return that $185 times two. So let me see here. When the Social Security Trust Fund runs out and say benefits get reduced 21%, waiting until 70 to start receiving benefits, would that be a wash, effectively getting benefits at fraud? Yeah, because if you wait till 70 to start your benefits, you get those, 3 years of delayed retirement credits, and a delayed retirement credit 1 year, you get an 8% increase. So 3 years, there's 24 years, or excuse me, 24%. And if they cut benefits, which, people say the president says he's not going to cut benefits. Correct. Well, the benefit cuts are going to happen automatically. They have been projected for decades that the trust fund is going to run out in about 2034 or 2033 probably. Now the new numbers aren't out yet, but yeah, about 21% cut, 22% cuts here in a few years. That's automatic because the trust fund is running out, because baby boomers are getting that in their check every month, and so that was their savings that they put away. So of course they're, hey, we put that extra savings into Social Security for us, 70 million people that are, born between 1946 and 64. And now we want our money back. And so they're getting their money back. So, and that's the trust fund. And then once that is exhausted and there's no more money in the kitty, then Social Security can only pay out what it receives in. It receives this amount in, it pays out that much. There's a gap, 21% gap. So everybody's benefit has to be cut by 21%. Now there's a gap. There's a gap today. It's here and here, but the trust fund is covering that gap. And that's why there's no cuts right now. But there will be automatic cuts here going forward because politicians have failed to do their job on both sides for decades. So, wow, I am way over an hour. I like to keep these to an hour, and so I am over. Let me go to one more question here. Oh, Claudia, thank you for the coffee/beer. Appreciate it. $4.99. Thank you. 62 years old, widow, receiving benefits with my adult son who is on SSDI. Can I apply for my own Social Security now? Yeah, you can. Absolutely. You can file for your own benefits. At the very least, I would check. Remember, your benefits will continue to increase until you hit 70 years old, because you're not touching benefits on your own record. So call up Social Security. Or if you already know, if your benefits, are going to be higher, and you need that extra $50 or $100 or something, get it. But maybe, okay, yeah, I need that extra $50, but if I wait a year, it'll be $100. If I wait 2 years, it'll be $150. If I wait 3 years, it'll be an extra $300 or something like that. So yeah, so don't just, look at, okay, it's extra 50, but if you need the $50, then take the $50. But if you can wait, it's definitely going to continue to increase. So yeah, call up Social Security immediately and check to see what you want to do. They'll give you the numbers, and then you can tell them at that time what you want to do. You're not obligated. When you call Social Security and you want to check out numbers like that, if you're able to get in, you say, okay, I want to check out my numbers. How much for this? How much for that? And then Social Security employees love it when you say, I'll think about it. Salespeople hate that's the worst thing you can tell a salesperson. But Social Security, they're like, I'll think about it. No, okay, fine, bye. I've got another 400 cases to work on. So if you want to come back next year or 3 years from now, then more power to you. So, all right. So I am over an hour, and so that is it for today. I will be back again tomorrow, and I'll get to as many questions as possible. Make sure you share, subscribe, all that kind of good stuff. And if you need any help with Medicare, Medicare Part D, the Medicare Supplement, Medicare Advantage, make sure you reach out to my partners at Chapter, and then they'll go over all of your. They'll, if you're looking for a new Medicare Advantage, they'll say, okay, what doctors you want to go to, what are your prescriptions? Let's try to find a plan that covers the most doctors, get you the cheapest prescriptions, it is the most least expensive for healthcare, and then look for all the bells and whistles, gym membership, and transportation and grocery cards and all that other kind of stuff. But look at the most important things first. So, all right, y'all take care. Have a beautiful night, and please